Prostate cancer is a condition that begins in the prostate gland, a small walnut-shaped organ situated just below the bladder and surrounding the urethra. At first glance, it may seem insignificant, but its location and function are critical. It produces seminal fluid and contributes to male reproductive and hormonal health. The disease itself starts at the cellular level. One or more prostate cells undergo mutations, losing the normal checks that control growth. Instead of following the body's regulatory rules, these cells start multiplying uncontrollably. This abnormal growth is what we call cancer. Initially, the cancer grows silently. Many men experience no symptoms in the early stages. The cells cluster into nodules, gradually enlarging and sometimes spreading to nearby tissues. This silent progression is what makes prostate cancer particularly insidious. It can exist for years before it's noticed. Some men might feel vague discomfort in the pelvis, more frequent urination, or difficulty emptying the bladder fully. But often these changes are so subtle, they're written off as part of aging or minor urinary issues. Blood in the urine or semen, persistent pelvic pressure, lower back or hip pain, and erectile dysfunction can appear later. But by that time, the cancer may have grown or even begun to spread beyond the prostate. Several factors contribute to the development of prostate cancer. Age is the most significant. The risk rises sharply after 50 and becomes substantial by the 60 seconds and 70 seconds. Genetics also play a major role. Men with a family history of prostate cancer, particularly fathers or brothers, are at higher risk. Certain inherited mutations, like BRCA2, can make prostate cancer more aggressive. Lifestyle and environment influence the risk as well. Diets high in processed meats and saturated fats, low physical activity, chronic stress, and long-term exposure to certain chemicals may all subtly increase the likelihood of cellular mutations and disease progression. Hormonal changes, particularly those involving testosterone, can also affect the growth of cancerous cells. Inside the body, prostate cancer begins as a small cluster of abnormal cells that divide more rapidly than normal. The immune system may detect and eliminate some of these cells, but often it doesn't catch all of them. Over time, the clusters expand, compressing surrounding tissue and potentially altering urinary and sexual function. The cancer can break through the capsule of the prostate, reach adjacent organs like the seminal vesicles, or spread through the lymphatic system or bloodstream to distant sites, such as bones or lymph nodes. This slow, invasive nature is why it's called a silent disease. It can progress for years with minimal or ambiguous symptoms. Symptoms, when they appear, often feel subtle or easy to dismiss. Difficulty urinating, weak or interrupted urine stream, frequent nighttime urination, and a sense of incomplete bladder emptying are common early signs. Pain or stiffness in the lower back, hips, or thighs may emerge if the cancer spreads to bones. Blood in the urine or semen can appear in more advanced cases. These symptoms are frequently overlooked, rationalized, or hidden due to embarrassment, denial, or misunderstanding. Many men normalize these changes as part of aging, delaying evaluation and diagnosis. The consequences of untreated prostate cancer depend on how advanced it becomes. In localized disease, the cancer remains confined to the prostate, often slow-growing and sometimes manageable with monitoring. When ignored, however, it can invade neighboring structures, compromise urinary or sexual function, and metastasize to distant sites like the bones or liver. Advanced disease can result in significant pain, fractures, systemic illness, and a profoundly decreased quality of life. Early detection and timely treatment dramatically alter these outcomes. Medical evaluation for prostate cancer involves risk assessment, blood tests like PSA, prostate-specific antigen, digital rectal examination, imaging, and sometimes a biopsy to confirm the diagnosis. PSA is not definitive on its own. Interpretation is nuanced, requiring consideration of age, prostate size, and other conditions. Imaging, including MRI or CT scans, helps determine the extent of disease, and biopsies provide tissue confirmation. This diagnostic process can feel intimidating, but it is essential for accurate detection and timely management. Treatment depends on the stage, grade, and growth rate of the cancer, as well as the patient's age and overall health. Localized disease may be managed with surgery, radiation, or active surveillance. Surgery removes the prostate entirely, which can affect urinary control and sexual function. Radiation targets cancer cells with focused energy but may also affect nearby tissues. Active surveillance involves monitoring slow-growing cancer with regular testing to avoid unnecessary treatment while remaining vigilant. Advanced cancer may require hormone therapy, chemotherapy, or combination approaches. These treatments carry physical and emotional effects, but they aim to control the disease, slow progression, and preserve quality of life as much as possible. Lifestyle factors remain important both in prevention and in supporting treatment. Maintaining a balanced diet, regular physical activity, good sleep, stress management, and avoidance of smoking or excessive alcohol helps the body respond more effectively to treatment and may reduce the risk of recurrence or progression. Awareness, regular screening after the age of 5, 0 or earlier for higher-risk individuals, and prompt attention to any urinary or sexual changes are critical measures that can genuinely alter the course of prostate cancer. In summary, prostate cancer is a disease that begins at the cellular level and progresses silently, often for years, before symptoms emerge. Risk increases with age, genetics, lifestyle, and environmental exposures. Symptoms, when they appear, can be subtle, including urinary changes, pelvic discomfort, blood in urine or semen, sexual dysfunction, or bone pain in advanced cases. Early detection through PSA testing, digital exams, and imaging is essential, and treatments range from active surveillance to surgery, radiation, hormone therapy, or chemotherapy, depending on the stage. Lifestyle factors, awareness, and timely evaluation play a critical role in both prevention and effective management of the disease.